the question is, when is enough to admit that the system you are a part of has drastically failed Americans?
In order to do good public health, in order for me to know what treatments are right for my patients, we need to do research. And currently, the NIH, the CDC budgets for research have been absolutely decimated by billions of dollars. In fact, I wrote down a few of them, if you don't mind me sharing, because I think it's valuable to talk about. So we're not talking in abstracts.
Okay.
For research, we've terminated $3.8 billion into cancer, HIV, ALS, and maternal health, important subjects. The entire NIH CDC budgets have been cut in half. We've created an issue where in the Environmental Protection Agency for the Office of Research, we fired over 1,000 scientists who do that research to figure out if there's toxic pollutants that cause negative health outcomes. We've cut the CDC branch for environmental health tracking for lead and water safety. We've canceled NIH diabetes prevention program that ran for 30 years. And we've eliminated the Federal Newborn Screening Advisory Committee. So that's just a few of them.
Okay. So considering all of that before, when we had all of that money, where did that get us? Look at the state of Americans' health, and you tell me that the public is actually healthy. Americans are fat and they are sick, and it is not getting better. And taking more and more money and continuing to flush it down the toilet is not going to solve the problem. The most important predictor of longevity, risk of chronic disease, all-cause mortality is VO2 max. So we're going to focus on VO2 max, because even if we stopped every dollar we had, putting it into cancer research right now, and we took that money and we said, let's get people moving, let's increase their VO2 max, cancer is stopped dead in its tracks. So the question is, when is enough to admit that the system you are a part of has drastically failed Americans?